Infectious diseases are a leading cause of death in Africa, though many of the diseases are treatable and preventable. VOA's Carolyn reports on an international partnership that is working to deliver better health care in Africa and stem the spread of infectious disease.
The Accordia Global Health Foundation is partnering with African countries to fight HIV/AIDS, malaria, and tuberculosis. The U.S.-based foundation brings medical expertise and contributions from corporate partners such as Pfizer to help develop skills and infrastructure in Africa to fight the epidemics of infectious diseases. When drugs were first introduced to fight HIV/AIDS, medical support systems in much of Africa did not exist. Kelly Willis is Senior Vice President of Accordia Health Programs.
Malaria takes the life of almost 1 in 5 children before their 5th birthday across Africa. Still remains one of the most pressing health challenges in Africa. Millions of people affected by the HIV/AIDS virus, but also tuberculosis, an epidemic of incomparable across the world, and other diseases like pneumonia and meningitis that take the lives of children every day in Africa.
In 2004, Accordia established the Infectious Diseases Institute, IDI, in Kampala, Uganda at Makerere University. It is seen as a model for healthcare innovation in Africa.
We've trained over 7,000 healthcare workers in Uganda and 27 other countries throughout Africa to use existing medications and technologies better, to be better clinicians or laboratory professionals. But I think where we place our impact is a little bit with a longer-term focus than that. So we really rely on the larger funders and the larger players to deliver services.
Last September in Uganda, leaders from 20 similar centers like IDI convened to analyze the sustainability of the program and how it could be replicated. Accordia looks to countries with academic centers that can support a healthcare institution. 2 priority countries are Nigeria and Malawi.
We have a very mature and well-vetted concept for a West African Infectious Diseases Institute in Nigeria. Nigeria is home to 1/4 of the population of sub-Saharan Africa and has the largest malaria burden on the continent. And so we envision that this Center of Excellence would focus first and foremost on malaria. And in Malawi, we have a much younger concept, but a very compelling one to look at childhood illness.
The goal is for the medical centers to be independent and run by Africans.
These centers are very independent now. It's part of our hallmark, actually. I should mention that in 2004 we founded the Infectious Diseases Institute. In 2005 we granted it to Makerere University. So IDI is wholly owned by the local university in which it sits, and is really a resource owned and led by Ugandans. And similarly, the West African IDI would be owned and led by Nigerians.
Accordia is working on recommendations for the long-term development of sustainable health care centers throughout Africa. Carolyn Turner, VOA News.